Good morning, everybody. Louder. Good morning, everybody. That's better. Thank you for being so energetic. I hope you had your good coffee this morning. So, before we even get into what's going on with today's program, and I'm going to be very brief about this, we do want to thank, though, our sponsors of this program. And we have, as you can see on the big screens, we have EMD Serono, we have Mallinckrodt, Genentech, and Celgene. And so I hope that you all appreciate, like me, for what they were able to do for us. All right? Again, and I say this from program to program to program, the pharmaceutical industry needs organizations such as MS Fusing News to provide these educational programs just so that you learn more about all the different aspects about multiple sclerosis. So, again, I am very glad that they're here doing this. And I did already mention the live stream, and I'm glad about that. And I do want to thank our audience out there. So, whoever you are, thank you for being here. Awesome. Our final speaker of the day, a lot of you are really going to love what this gentleman has to offer. He's not just a gentleman, he obviously is a doctor. And Dr. Mehta, he's trained as a fellow in the program of Integrative Medicine at the University of Arizona with Dr. Andrew Weil. Board certified in internal medicine and sleep. His expertise includes nutrition, exercise, sleep, yoga, and mindfulness to achieve wellness in the context of coping with chronic medical conditions. Dr. Mehta's research includes the use of preventive medicine and positive health behaviors to help improve the quality of life. Dr. Mehta's team is comprised of experts in complementary techniques, and they have developed innovative, client-centered wellness programs aimed to enhance quality of life through the spectrum of care. Dr. Mehta envisions integrative medicine as a driving force towards a new idea of quality health care where patient satisfaction and experience are given due to importance of what everybody needs. So let's welcome Dr. Mehta. I don't know where he went. Where is he? Oh, there he is. He's surprising me.
Great. Thank you, Stuart, for that kind introduction. This is the second year that I'm doing this talk for you all. Good afternoon, everyone. I'm delighted to be here with you to talk about a subject that is very near and dear to my heart. So, you know, I entitled this presentation, "This is Your Brain on Hugs," because, you know, ultimately, so much of our well-being is related to our connectedness, is related to how well we let go and surrender and actually be compassionate for ourselves. So all of these things are kind of mainstays and central principles of the integrative model. So I'm going to be sharing with you what is the definition for integrative medicine. There's oftentimes a bit of confusion as to what is integrative, how is it differing from alternative or complementary. So sometimes these terms can be a little confusing, so I'll get into some of that. And then I'm also going to be describing the role for integrative medicine in the non-pharmacologic management of multiple sclerosis. Now, very rarely is it exclusively non-pharmacologic. I mean, oftentimes these modalities are recommended in combination with the cutting-edge medical technologies that we have available to us. I'm also going to be presenting some of the evidence for nutrition, physical activity, quality sleep, acupuncture, and mindfulness for healthy brain activity. So many Americans, about 40%, use what are known as complementary or alternative medicine modalities. These are approaches that are developed outside the mainstream medicine or conventional medicine for specific conditions or overall well-being. So complementary generally refers to using a non-mainstream approach together with a conventional medicine. An alternative refers to using a non-mainstream approach in place of a conventional medicine. And this is not generally what we recommend because, you know, we should take advantage of all the wonderful medicines and treatments that can be made available in modern medicine. So integrative medicine is very much a client-centered wellness model. Client-centered means the first question that we ask anybody who comes to see us in the integrative medicine program is, what are your goals? What are your priorities? You know, and that's a very different question. That actually sets the tone for a very different type of consultation in our practice. Because we want to make sure that you are achieving what you would like to achieve during your time with us. So it's important for us to know what your goals and priorities are. So that's the first question we ask. It's very much a partnership between provider and client. We do everything from prevention to active treatment. We use natural, effective, non-invasive interventions whenever there's good science to support their use. And we use both conventional as well as non-conventional modalities in combination with one another. So I oftentimes recommend any client who comes in to see us actually come in with their family members, with their caregivers, with friends. Anyone really whom is in your inner circle of trust should accompany you during the visit. And the reason is because when it comes to positive health behaviors that are designed to improve your overall well-being and enhance your quality of life, you're not implementing these positive health behaviors in a vacuum. You're implementing them in the context of a home, in the context of a family, in the context of a daily, weekly routine. So we always advise and encourage our clients to come in with someone so that, both gain an understanding and an appreciation for why we're recommending what we're recommending. So we engage mind, body, spirit, and community in that way. We also encourage our providers to model healthy behaviors and lifestyles for our clients. And we focus attention on lifestyle choices for prevention and maintenance of health, and we maintain that some degree of healing is always possible. It's a very powerful affirmation. Now, this is Emperor Huangdi, who is known as the Yellow Emperor from ancient China, and he wrote the canon of Chinese medicine in 2600 BC. Well, he's oftentimes credited with creating the first healthcare system in the world. Now, in his healthcare system, you would actually pay your doctor every month until you got sick. Once you became unwell, they would stop paying you. So the incentive was actually to keep you healthy, to keep you happy, to keep you productive, to keep you well, and to really partner with you, preventatively in order to make that good health possible. So what's interesting is that, we are actually almost 360 degrees back to where they were in 2600 BC. Because now healthcare, the economies of scale, the macroeconomic forces that are going on in the healthcare here in the United States are actually forcing us to assume a much more preventive and proactive model. When it comes to using positive health behaviors and exercise, nutrition, mindfulness techniques, all of the things that you've heard about today, really, they are under the auspices of integrative medicine. But frankly, eventually, we hope that the word integrative is just dropped and that this just becomes regular medicine, common sense medicine. Medicine that actually strives to empower our clients with the information that is available in the literature that helps to empower individuals to help feel better. And you've seen some wonderful examples today. So I really enjoyed watching all of the other, hearing all of the other speakers and what they had to say, because all of these things are very empowering. Exercise is empowering, right? And when you feel better, not because of any medication that has been prescribed to you or any surgical procedure that has been done to you, but when you feel better because of the daily practices that you are putting into place, bit by bit, you feel like you're in greater control of your health destiny. And that health efficacy is really a mainstay of the integrative model. So we really, I think it's really important that in medicine we do a better job of empowering people to help unlock the innate healing intelligence that is built into our human body, instead of what has been the tradition in Western medicine, which is, eat whatever you want, be sedentary, we will treat you in spite of you. And that's just not, that we've understood now that that is a very ineffective and certainly an incredibly expensive way to try and, establish a healthcare system. So we're really trying to put the health back in healthcare using the integrative model. So these are some of the symptoms that are associated with, a tired brain. You can oftentimes feel fatigue, weight loss or weight gain, poor sleep quality, Negative mood, sometimes even full-blown depression, anxiety, chronic headaches, neuropathies, pain, physical deconditioning, sexual dysfunction, and constipation. All of these things, you can imagine how a lot of these things are kind of clustered together. We refer to them as kind of a constellation of symptoms because you can imagine if somebody's not sleeping very well, then they're going to be fatigued. If they're fatigued, they're going to be largely sedentary, and they may actually have, more tendency to develop negative moods. So a lot of these symptoms are interconnected and kind of woven together. So it actually, because of the cyclical nature of these symptoms, it really warrants an integrative approach where we try and break this cycle of symptoms in multiple different levels using nutrition, exercise, mindfulness practices, stress management techniques, good sleep hygiene, and the like. We also use therapeutic yoga and acupuncture as well as massage therapy in our practice. So what's interesting is that, Dr. Dale Bredesen, who has really done a tremendous amount of research on how to help the brain heal and feel better, has kind of identified the different ways that the aging brain can be impacted over time as follows. There's the inflammatory category, which is hot. The atrophic category, which is cold. Toxic is sweet. Vascular is pale. Traumatic is dazed, and sleepy is slow. So, oftentimes there's a lot of combinations of things that are going on in order to impact the brain functioning, right? So that's another reason why the integrative model is so useful. And whether you call it integrative medicine or functional medicine, really we're all getting at the same thing. And we do a lot of screening when it comes to the integrative model. We use a lot of hemoglobin A1C we check. We do a comprehensive sleep screening, and I'll talk a little bit about the importance of sleep and why it's so essential for brain health. We check homocysteine levels, inflammatory markers like highly specific CRP, and other inflammatory cytokines. Oftentimes the microbiome we also check. So this wonderful entity known as the microbiome. Well, I think of the way I'd explain it to our clients is that the microbiome is like a tropical rainforest. Think about all the good bacteria inside our digestive tract as an abundance of wonderful, healthy plants that exist in a tropical rainforest in a very harmonious ecosystem that is in a symbiotic relationship with our own immune system. So what happens is that over time, the kinds of things that we eat oftentimes are laden with preservatives. It's because, especially here in the United States, oftentimes our food is coming from very far away. And to keep the food fresh or bacteria-free, a lot of antimicrobial agents are added as preservatives into that food or into the packaging of that food. So over time, when we start eating and when we continue to eat this type of food, it kind of wears down that tropical rainforest. It's like a gradual deforestation of the microbiome. So it behooves us to eat lots of fiber, because fiber is what we call a prebiotic. If you think of all the good bacteria as the probiotics, well, those good bacteria have to float down the stream of the digestive tract on the prebiotics, which is fiber. So we've actually increased our daily fiber intake goals to about 40 grams a day, and that's a lot. That's a lot of fiber. So we use fiber. We use a lot of probiotics, so foods that have healthy, good bacteria to kind of replenish. It's like replanting the seeds of that rainforest to help that healthy rainforest grow back. So the microbiome is so incredibly important. Oftentimes we get exposed to organic solvents and heavy metals that just accumulate in connective tissue over time, and these toxins actually create inflammation and can actually predispose the immune system to be hyper-inflammatory and actually, exacerbate a lot of different types of autoimmune phenomenon. We check ApoE4, which is in the realm of the fatty acids, the fatty acids within the body. We check vitamin D as well as thyroid function. We sometimes do some hormonal testing if we suspect that there's some hormonal influences, and we always check a lipid panel, which is, the cholesterol. So the integrative medicine, what do we do when we're actually trying to help heal the brain and reduce the inflammatory burden in the brain? Well, we use a combination of nutrition, exercise, mindfulness techniques, sleep, acupuncture, massage, yoga. We use music and art therapy. We have both individual as well as group programs, and really what we're getting at is this link between pain and inflammation. I say wherever there's pain, there's inflammation, and oftentimes wherever there's inflammation, there's pain. And oftentimes where there's this combination of pain and inflammation, there ends up brewing this spasmodic tendency, the spasm, the tightness, right? So all of these modalities used in combination with one another in a very individualized approach really helps reduce that inflammatory burden, lessens the pain, and also thereby decreases that spasticity component as well. Let food be your medicine. This is so incredibly important. And you know, we use a lot of nutritional risk reduction strategies. There's really impressive evidence about things like cruciferous vegetables, which contain compounds such as inositol hexaphosphate and indole 3-carbinol. These are really wonderful antioxidants. There's a lot of really tremendous research coming out now about the compounds in mushrooms, particularly Asian mushrooms. And what's funny is that the more exotic they sound, the better they end up being for us. You know, so the maitake, shiitake, enoki-daki, reishi, blazy, these are all really healthy because what we found is that there are these proteoglycans, these compounds in the fungal cell wall. These compounds are actually immunomodulators. So when it comes to wisening up, smartening up our immune system, and actually, these fungal organisms have a tremendous body of science behind them, especially in Eastern ancient healing traditions, such as traditional Chinese medicine and the like. Turmeric and ginger, right? So the ancient Ayurvedic formula is a lot of turmeric boiled in a fatty type of substance with coconut oil and such. So these are the kind of Ayurvedic techniques that come from ancient India. And what we found is that actually there are these really healing compounds known as curcuminoids, which have a tremendous antioxidant benefit in the brain and other places in the body. And what's nice is that I always encourage my clients, you know, if you're making a pot of brown rice or quinoa or whatever, you know, it's nice and easy to just put 2 big tablespoons of turmeric in whatever you're cooking. It's kind of a very earthy flavored spice. And it's designed to be blended together with other spices in order to really create different mixtures. And you know, oftentimes it is mixed up with black pepper. And you just have to be careful with black pepper because black pepper has a compound in it known as piperine, and piperine actually interferes with the cytochrome P450 system, which is one of the body's ways of metabolizing certain medications. So do be careful with black pepper, but the ancient Ayurvedic formula is actually using black pepper with the turmeric and mixed into a heated mixture with something very fat, because these curcuminoids, they don't dissolve in water. These curcuminoids dissolve in fat. So there's a tremendous body of science now emerging about how curcuminoids can actually help reduce the inflammatory burden in the body and have a tremendous antioxidant benefit as well. Green tea. I'm a big fan of green tea. Green tea has these compounds in it known as catechins. And there's one particular class of catechin known as epigallocatechin gallate, which is a really nice antioxidant. It's one of the most, so a lot of my clients who have trouble sleeping, oftentimes they're fatigued during the day, so they get into this cycle of kind of medicating with caffeine. So they're taking a lot of caffeine during the day and then not sleeping well at night because caffeine is kind of interfering with the sleep architecture and getting into this kind of, you know, up and down type cycle, which is really not good for the immune system, because what ends up happening is that sleep, I'm going to talk a little bit about what happens to our brain while we're sleeping and how the immune system is impacted during sleep. But this cycle is actually unhealthy, and a lot of times when I notice that my clients are drinking an excessive amount of caffeine in either energy drinks or coffee, I oftentimes recommend green tea as a substitute, so 1 or 2 cups of organic green tea to kind of decrease the caffeine burden in the body, thereby improving sleep quality. And we're going to talk about what sleep does in the brain and in the immune system in just a moment. And we also check vitamin D levels. You know, even here in sunny Florida, a lot of us are vitamin D deficient. And the recent research on vitamin D actually shows that what we used to consider normal is actually suboptimal. So we aggressively replenish vitamin D levels to about a level of about between 50 and 80 of 25-hydroxy vitamin D. And you can ask your primary care doctor or even your neurologist, if they might tack on a vitamin D level just to see where you're at. This is one of my favorite studies that has been published recently. And now this was looking at cancer survivors. But what they found was that yoga actually has really beneficial impacts on focus, memory, and concentration. And one of the ways that yoga impacts our focus, memory, and concentration and overall brain health is by improving sleep. So they found sleep to be the mediator and the reason why there was improvements in brain cognitive functioning. So what's happening during sleep? Well, I think of sleep as a symphony. If you think of every single organ system in the body as a different instrument section in a symphony orchestra, they all have to play in a coordinated manner to get from one movement of that symphony into the next. Well, melatonin is the conductor of the symphony orchestra. And the different movements of the symphony actually are the different stages of sleep. So there's 4 different stages of sleep. There's stage 1, stage 2, stage 3, and REM sleep. Now, REM sleep is so fascinating to me because it's the stage of sleep when our core body temperature actually cools down a little bit. So what ends up happening is that, when you defragment your hard drive on your computer, well, that's kind of what's happening in your brain when you're sleeping and when you achieve that deep, more restorative stage of sleep. So oftentimes if sleep is of suboptimal quality or insufficient duration, we're not spending enough time in this very healing, restorative stage of sleep, which is called REM sleep. So the other interesting thing about REM sleep is that REM sleep is when our core body temperature cools. And the reason it cools is because almost all of our muscles in the body completely relax. So our core body temperature actually drops down about 1.5 degrees. Well, what do they tell you to do if you hurt your shoulder, your ankle? They tell you to ice it, right? Well, we have our own systemic icing mechanism to reduce inflammation throughout the body, but it happens during REM sleep, the deepest, most restorative stage of sleep. Now, here's the other thing that you should know about sleep. Oftentimes, if you're taking an antidepressant medication, like a selective serotonin reuptake inhibitor, an SSRI, which is a very common class of antidepressant medications, SSRIs are one of the most potent pharmacologic ways to suppress REM sleep. So, these are the kinds of things that we really tease out in the integrative practice. And it's not that we don't use these kinds of medications, we do. But we use them as a transient step in order to really engage and empower with other positive health behaviors so that eventually we can gradually take some of these medications away in a very judicious and organized way. So this is a wonderful study that looks at how yoga improves brain health through improvement in sleep quality. We use a lot of massage as well. Now there's a connection between chronic pain, this entity known as fibromyalgia, and sleep. And it's actually, the connection is substance P. So substance P is actually increased in anybody who's experiencing chronic pain. So massage improves sleep quality, and during sleep is when substance P is actually rinsed away. So a lot of inflammatory mediators that actually modulate pain and our experience of pain are oftentimes decreased and washed away, rinsed away during those deeper, most restorative stages of sleep. So sleep is so incredibly important, and oftentimes, we all have kind of heard about what's good for us in terms of nutrition and exercise, but we get this fatigue because we're getting bombarded with this information all the time. Well, in our integrative practice, oftentimes we don't start with the nutrition or the exercise, we actually start by sleep. Let's focus on getting you a good night's rest. Let's focus on the ability to surrender and let go when it's time to let go in the evening time. And let's focus on more restorative sleep quality, thereby increasing energy levels and enhancing one's motivation to engage in the wonderful exercises that Jeffrey just showed us in previous talk. So we start with sleep, and that's kind of the hook. So we also use acupuncture. What's really nice is that articles such as this have been looked at, have been published, and have been looking at modulatory effects of acupuncture on brain networks in people who are experiencing mild cognitive impairment. So exercise is medicine. I'm going to kind of gloss over this slide because we more than just, what's in the research, we've had a very experiential time this afternoon to look at how exercise can be used for greater core body strengthening and balance. So look at this. This is a multimodal exercise training in multiple sclerosis, a randomized controlled trial in persons with substantial mobility disability. What they found was that 83% participants participated, and each of these individuals had significantly impaired mobility. They underwent a supervised multimodal exercise intervention that includes some aerobic, some resistance, you remember the bands, that's the resistance training piece, and balance exercises. And what they found was that there were significant improvements after 6 months in the 6-minute walk performance and peak power output. So exercise is medicine, movement is medicine. Now look at the research that's being done on mindfulness. Mindfulness is quite an interesting, every healing tradition the world over has tried to engage the power of the mind in the healing process. So I would say, in modern day research, in modern day science, we're actually playing catch up to kind of really elucidate the factors that are being impacted when we practice stress reduction techniques like mindfulness. So look at the types of, how many publications are being written about mindfulness, and look at the fervor of scientific inquiry that is going on in this area. So optimizing mindfulness-based stress reduction for people with multiple sclerosis, and an initial, at times unpleasant increase in awareness of disability was then generally followed by greater acceptance and self-compassion. And this is sort of the journey that is mindfulness. Oftentimes there's a lot of misconceptions about meditation and mindfulness, and we set those expectations so high for ourselves, sometimes even too high for ourselves. So we think that mindfulness, the only successful meditation practice, is if we can erase all thoughts from our mind as if it were some type of etch-and-sketch toy. Well, that's not what mindfulness is all about. Mindfulness is really about non-judgmental awareness. Who do we judge most harshly? Ourselves, right? This word should, I should be able to do this, or I should be feeling better, or I should be responding better to this treatment. This word should is kind of a way that we use to kind of beat ourselves up a bit. And we all do it to a certain degree. So mindfulness is simply a way where we become more aware of when we're beating ourselves up with this word should. And that's really the first step of mindfulness. The first step of mindfulness meditation is simply this non-judgmental awareness. Oftentimes the mind is described in certain Eastern traditions as being like a monkey, the monkey mind. So the monkey mind is kind of jumping randomly from one thought to the next, like a monkey jumping from one branch to the next. And if we were to sort of forcibly subdue that monkey mind and force it to be silent and quiet, it's going to actually fight back. It's going to become even more irritable. So really the first steps of mindfulness are, we kind of want to be the Jane Goodall of the monkey mind. We want to kind of hang back and observe what's going on in the mind with non-judgmental awareness. And that's where these breathing exercises and creative visualization techniques and affirmations really come in, that are all part of a comprehensive, individualized mindfulness recommendation or prescription. So there's a range of psychologic and cognitive benefits, including reduced psychological symptoms, reduced depression, anxiety, reduced emotional reactivity, enhanced behavioral regulation, increases in compassion and altruistic behavior, enhanced attentional skills, and also improved resilience. How can we bounce back from adversities? How can we actually, how can we kind of climb back into the saddle and feel like we are back in control of our physical and mental health? Right? These are the stages, this is the impact of mindfulness. So how does it work? Well, we found that actually mindfulness and meditation techniques actually change the brain structure. So mindfulness changes brain structure and function. So after 8 weeks of sustained practice of 27 minutes per day, they found increases in gray matter density in several regions of the brain. Mindfulness changes short-term gene functioning. So actually what we found is that energy metabolism, mitochondrial function, insulin secretion, and telomere maintenance are all improved in mindfulness practitioners. Decreased inflammatory response and decreased stress pathways. So mindfulness is really fantastic, and it should be incorporated along with nutritional advice and movement as medicine, as well as good sleep hygiene in order to overall improve brain health. Now, during the panel discussion, there was kind of a a dialogue about medical marijuana and its role in managing symptoms and enhancing quality of life. And I just want to make a comment because, you know, I think really the conclusion was that some doctors are using it, but most are using CBD, which is the non-psychoactive component of medical marijuana. Now, and I think that's reasonable, and here's the reason, is because certainly this plant is medicine, and you know, just like any other medicine, it needs to be used judiciously, and it needs to be used very scientifically. So the science in medical marijuana actually shows us that there are significant anti-inflammatory properties of CBD. And that's good, that can be helpful. But the other thing that I want to caution you about is the psychoactive component of THC. Now, THC, oftentimes, it can cause what is known as amotivational syndrome. So be very careful about this, because what ends up happening is that in the integrative model, we're trying to empower, we're trying to engage our clientele, we're trying to motivate. I sometimes feel I'm sort of a mix between a problem solver, an educator, and a cheerleader in my integrative medicine practice, because we're trying to get people to get moving and make these positive steps towards better health behaviors. Well, if you're actually using something that makes you amotivational, that kind of takes the wind out of your sails, then you know you must be very careful about that. So that's all I'm going to say about medical marijuana at this time. But there is some very promising and interesting research that you can look at. Now, we also have a physician wellness program at Memorial. And the reason we have that is because, can I just get by a show of hands, how many are caregivers in this room? How many of us are care providers or caregivers? Yeah, quite a few, right? So everyone who is a caregiver or in the caregiving profession is at risk for compassion fatigue. You know what they say in the airplanes? They say, put the mask on yourself first and then administer assistance to everyone around you. Well, what do we often do is we do the exact opposite. And so, you know, the application of integrative methods is really a team, family-based endeavor, right? So all of the things that we encourage anyone who is impacted by MS to do, we also want the caregivers to do, and we also want the nurses, doctors, social workers to do. So that's why in Memorial we've invested heavily in the physician wellness component and employee health components, because at the end of the day, who's going to heal the healers? Right? So this is also very important. We always encourage our providers to model healthy lifestyles and model healthy behaviors for those whom we're caring for. And in addition to this, you know, when it comes to nutrition, oftentimes, you know, we need to simplify our nutritional approaches considerably, because there's so much information out there, and oftentimes it's difficult to practice some of these really challenging nutritional recommendations in our day-to-day life. So integrative medicine is like slow medicine. So all of the things that we talk about and recommend in integrative medicine, they work gradually and they work subtly over time. So everything that we talk about really only gives about a 2 to 3% benefit. So if we're using movement as medicine and sleeping well and we're mindful of our nutrition and of our stress levels, each of those things really only improve your overall quality of life by about 2%. But when you add 2% with 2% with 2% with 2% over time, the trend lines become very favorable. And all of a sudden, you feel more empowered, more in control of your physical and mental well-being. And that's really the central pillar of the integrative medicine model. And you know, from a nutritional standpoint, you'll read a lot about the macrobiotic diet or the anti-inflammatory diet or the ketogenic diet or the alkaline diet and the vegan diet. So all of these diets have their value and their importance. However, they oftentimes also complicate things. They sometimes can make your nutritional horizon so narrow that you end up thinking, well, goodness, what am I supposed to be eating? So we actually simplify it considerably. All you really need to remember are 10 words. Less meat, teat, wheat, and sweet. Pretty simple. Less meat, less dairy, that's the teat, less wheat, processed grains, and less sweet, sugar. So those are the five words you must remember. Less meat, teat, wheat, sweet. More roots, fruits, leaves, and flowers. I'll get into the details. So roots, fruits, leaves, and flowers. So more roots, that's your carrots, beets, turnips, radishes, ginger, turmeric, actually, what I mentioned before, is a root. So more roots, more fruits to your heart's content. We're very fortunate here in South Florida to have an abundance of tropical fruits. So just be careful, because oftentimes there's higher and lower sugar sometimes in different types of fruits. So what you want to be aware of is the glycemic index, the speed at which sugar is transferred from the fruit into the body. Let me give you an example of the glycemic index principle. So if you were to just have an apple, there's almost an imperceptible rise in your blood sugar. Your blood sugars pretty much stay the same. Now, if you were to have applesauce, there's a bit of a bump in your blood sugars. And if you were to drink apple juice, there's a very sharp spike in your blood sugar. So that's actually an example of the glycemic index. And so what we do is any of those tropical fruits, the ones that I happen to love, the mangoes, the pineapples, the bananas, all of these are tropical fruits. They actually have a slightly higher glycemic index. So they have a higher sugar content, and they create this glycemic load in the body, which can actually be a precursor to inflammation. So be careful about the glycemic index, and one of the ways that we actually encourage to reduce or mitigate the sugar-raising effects of some of these tropical fruits is to mix them with other healthy foods. Like, for example, if I want to eat mango, I actually make a spinach walnut mango salad, which is baby spinach and some walnuts, a little bit of balsamic, a little bit of feta or goat cheese if you wish, and mango sliced on top, right? So that's an example of how you can actually reduce the blood sugar raising effect of some of these fruits by mixing them with leafy green vegetables, nuts and seeds, and so on and so forth. So less meat, teat, wheat, sweet, more roots, fruits, leaves, flowers, done. And make sure you drink enough water as well. So many people who come in to see us are in this state of perpetual dehydration. So it's really important that you get the bare minimum at the very least. So how do we know what the bare minimum is for you? Well, you take your body weight in kilograms and you convert that into ounces. And that's how much water you should be drinking every single day. And you can't manage what you don't measure. So actually measure how much water you're drinking, because you may actually be drinking a lot less than you think you're drinking. And one of the quickest ways to make the brain really unhappy and to sort of increase the inflammatory burden in the body is by allowing this chronic dehydration to set in. So really be aware of how much water we're drinking. So if you use a combination of hydration, movement as medicine, good sleep hygiene practices, and good nutrition, we're going to be on our way to better and better health. And when you combine that with mindfulness meditation and the judicious use of acupuncture, massage, as well as some natural health products, vitamins and supplements and the like, in order to improve your health, when you start using all of these in combination, that's when you really start feeling empowered. That's when you really start feeling, you have a degree of control over how well you're feeling. And what we do on a day-to-day basis when it comes to sleep and movement and nutrition is just as powerful, if not more so, than so many of the commonly prescribed medications. I'm going to end with this quote. It's from Daniel Siegel, who wrote The Mindful Therapist in 2010. It's the rationale for our wellness and integrative medicine model. And he says, research suggests that our presence as medical or mental health clinicians, the way we bring ourselves fully into connection with those for whom we care, is one of the most crucial factors supporting how people heal and how they respond to our therapeutic efforts. Thank you so much for your attention and enthusiasm. I'm so delighted to be here.
Now that was great, wasn't it? Give him a bigger hand there.
Thank you. Thank you.
Who's got the first question? Down on the other side, we're going first.
Hi, I want to know what's the best form of the turmeric that you can get, because you can buy it on the spice rack, you can buy the root, you can buy it in tea. Like, what are the best and most effective ways to actually get it in our bodies?
The spice works perfectly fine. We generally advise our clients not to go for the supplement, and there's a couple of different reasons for that. But the most biologically available form is simply when you're using the spice and mixing it with other spices. So just the regular ground up spice is probably the most effective way. And there's several recipes that you can use. In fact, there's a ginger turmeric latte that is that's delicious, very palatable, and you can use that as part of a daily routine, kind of a morning drink, which is both anti-inflammatory and also detoxifying.
Next question.
Are you with me, Doctor?
Hi.
Hi. That was excellent.
Thank you.
Really, could you address dairy?
So, dairy, what ends up happening is that there is a lot of genetic variability between different populations of, human beings across all globally with regard to how well we can degrade some of the mammalian proteins in dairy. So what ends up happening is that, have you ever thought about why the digestive tract, why we don't digest ourselves? Well, the reason we don't digest ourselves is because we lack certain enzymes to break down mammalian proteins. And the proteins in milk are actually mammalian proteins. So what ends up happening is that your immune system, 40% of our immune system is actually clustered around the digestive tract in these clusters of cells known as mucosal-associated lymphatic tissue. So mucosal-associated lymphatic tissue is incredibly important because these immune cells, they're watching what we're eating. They're performing kind of a sentry role. And what they're looking for is anything that might be harmful that we eat or drink. And when those immune cells actually see some of these dairy proteins, they say, well, it kind of looks very similar to the mammalian proteins of our own body. So we lack the enzymes to degrade them and break them down into their component parts, but there are a lot of inflammatory proteins like casein and so many of these other ones in dairy, and they kind of gradually increase the inflammatory burden in the body over time in some individuals. And so we use what we call a modified elimination technique, which is a very structured way of identifying what types of things you might be hypersensitive to, because oftentimes we go through life having a food sensitivity or sometimes even a full-blown food allergy, but because we're not swelling, our lips are not swelling up and we're not getting anaphylactic, we think that we're tolerating these foods okay, when actually they are creating a heightened degree of inflammation in the body. So using this structured way known as the modified elimination diet, you can actually look, the University of Wisconsin Integrative Medicine program actually has put out and made available this modified elimination diet where you can actually choose the usual suspects when it comes to foods that contribute to inflammation. These include peanuts, egg, soy, dairy, gluten, right? And you can use kind of a structured approach month by month to kind of document your symptoms relative to what kinds of things you've eliminated using this very methodical approach. And that's why we oftentimes use the elimination diet to identify whether someone is really able to tolerate dairy or whether it actually might be contributing to some of the symptom cluster that I mentioned.
It's not good for the
Right, I agree. I agree with you. I agree with you.
Yeah, I have two questions, if you don't mind. First one is, I grew up thinking that 100% whole wheat was beneficial for you as far as fiber goes, and now you're saying no wheat, so I'm a little confused.
First I said less wheat, less meat to eat, wheat sweet. And the reason is, there is no perfect diet, really. If we're making better food choices more often, we're heading in the right direction. So again, my goal is never to have somebody, change their nutritional practices or the kinds of foods that they're eating to be 180 degrees opposite to what you're used to and what you enjoy. So keep that in mind, number one. And number two, it's less that wheat is bad, but it's kind of the way that it's processed. For example, even 100% whole wheat it goes through a tremendous processing steps. And some of these processing steps actually introduces bleaching agents and other things into this grain that is called wheat, and that can have a lot of overwhelming deleterious effects for our health. So yes, it has been marketed as a healthy grain. There are so many other healthy grains out there. One of the reasons that wheat has been marketed and dairy has been marketed to be healthy is because that's what's around. Everything has corn in it, everything has soy in it, and that's because the infrastructure that we have here in the United States is abundant, these types of foods in abundance. But what ends up happening is that when you have something in abundance, you end up processing it and then introducing the processed form as an additive into so many other different convenience foods, and all of a sudden it's not as healthy for you as the original plant. Right? So when you're using a plant-based nutritional approach, really be mindful of how processed the foods that we're eating are, and try to eat them in their more original forms. And when we do that, things like wheat actually end up being more healthy, or more healthy than not as healthy as they've been marketed to be historically, but certainly more healthy for us in their more original plant-based form.
And also, I was wondering if your services are covered by insurance.
That's a good question. Some are and some aren't. The nice thing about Memorial is that we've invested heavily in this integrative model, because we believe that it really is important in the future of healthcare. This whole notion that we can just continue on doing more stuff and prescribing more meds and more lab tests, and we can sort of prescribe our way to better health is a misconception. So insurance companies are catching on that if we use a more proactive and preventive approach towards better health, all of a sudden there's less hospitalization for preventable conditions. So insurance companies are learning that some of these things that we call integrative actually should just be mainstream medicine. So my clinic is covered. I'm a sleep medicine expert by training, and sleep medicine is always a part of our dialogue. So, the physician consultations, yes, are generally covered by commercial insurances and Medicare as well as Medicaid. And then in addition to that, certain other things that we offer, like the therapeutic yoga, are oftentimes grant funded. So, philanthropic support, some benefactors have actually, helped us grow and build up our yoga program. And then there's out-of-pocket expenses oftentimes for things like massage and acupuncture. So it's kind of a combination of, yes, some things that are covered by insurance, some things that are hospital supported, some things that are benefactor and grant supported, and some things that are out-of-pocket.
Next question here.
Going back to the turmeric, I've tried taking this supplement in 2 different occasions for a certain amount of time. And it works great for my MS. It's probably the closest thing I've found to the times that I've taken steroids. However, it upsets my stomach so badly to the point that the last time I tried it, my doctor actually sent me for an ultrasound because he thought maybe it was a gallbladder issue, which it wasn't. And the minute I stopped the turmeric, my symptoms went away. So is there another form of maybe another method of taking it? Because I do get benefits from it.
You were taking the supplement?
I was taking the capsules.
Capsules. So oftentimes the supplements have other things in them. So be really careful, because supplements, all natural health products, do we use vitamins and supplements in our practice? We certainly do. Do I use them myself personally for better health? I do. But we take a very judicious approach to the use of supplements, and here's why. Because, these types of supplements and vitamins and such, they're not regulated like pharmacologic agents, yet we're using them kind of like medicine. So, we always encourage our clients to look for those supplements that have been very well vetted with regard to authenticity, purity, and potency. Oftentimes it's not necessarily the turmeric that is causing you that inflammation, but it's something else. It may be some other contaminant, heavy metals, organic solvents that are used in the extraction method. So much of the processing that actually makes the supplement or creates the inflammation that you experienced. So oftentimes it's not the turmeric itself. So all the vitamins and natural health products that we recommend have to meet the following criteria. Every single batch of that product has to be tested for authenticity, purity, and potency. Authenticity is what's on the label is in the product, what's in the product is on the label. Second, purity. So it's free of any heavy metals or organic solvents or yeasts or even bacterial contamination. And then potency. However much the standardized extract, if it's a standardized extract, then however much is in the label is verified and is also in the product. So authenticity, purity, and potency, these are the 3 things that we use in order to establish which products we're going to use and we make them available through something called a green pharmacy. So Memorial has a green pharmacy, which has these products available, kind of our most commonly recommended, vitamins, herbs, natural health products and such. And so we're growing that process as well, because there really needs to be some transparency or increasing transparency about this whole concept of use of nutritional supplements in combination with medications, because oftentimes there can be herb-drug interactions and such. So we're really trying to increase that transparency as well. So part of our Green Pharmacy initiative is to make sure that every single natural health product that somebody may be taking to improve their health is actually also reflected in the electronic medical record. So every physician knows that, they're taking milk thistle or turmeric or omega-3 fatty acids. These things are very important because oftentimes, they can actually contribute to increased bleeding risk. Right? So that's a long-winded way of saying that oftentimes it's not the actual turmeric itself, but some other additives or some other component of that supplement. So look for good quality supplements, and I'm happy to talk offline about what some of those may look like. But really also to use these, the key concept is really to use food as medicine. And that's why, the question about, using the herb or the spice in spice form, that's really the ideal. Using turmeric in your kitchen and being kind of an apothecary, to strengthen and enhance the functioning, the healing of, in the immune system and reduce this inflammatory burden. And I'm glad that you've initially found benefit from it, but oftentimes you can kind of experiment a little bit and make it a little more palatable by combining it with other herbs and spices.
I was wondering, quinoa and inflammation or immune response with quinoa?
So there are certain individuals who just have a, kind of a heightened inflammatory response to any type of different grain, right? It can be millet, it can be spelt, it can be quinoa, amaranth, sorghum, all of these. So, it's a very individualized approach. Generally speaking, quinoa, both the yellow and the red types, are fairly well tolerated. As a substitute for wheat and wheat flour, oftentimes we do recommend quinoa with the footnote that sometimes some individuals may have a mild sensitivity to the protein component in some of these grains. And so really it goes back to the modified elimination technique and kind of experimenting on your own what type of ancient grains are most healthy for you and which ones you tolerate the best.
Question here?
Yes, hi. A couple quick questions. Green tea. How do you
Love it.
find that as green tea that is not caffeinated? I look on the boxes for caffeination, and they all have caffeine. And the second is almond milk and cashew milk. Is that better for you then, or is that the same problem?
So good. So let me take your first question. The green tea, so green tea does have a little bit of caffeine in it. So if you take the sort of standard American drip cup of coffee, it's got about between 80 and 100 milligrams of caffeine. Okay? If you like the Cuban coffee that so much of us enjoy down here in South Florida, it's got about 120, 140 milligrams of caffeine. Regular black tea has about 40 to 45 milligrams of caffeine, and green tea has about 20 to 25 milligrams of caffeine, which is actually a really small dose of caffeine, number one. Number two, there are certain, organic green teas that are decaffeinated. You can find those. I do highly encourage organic green tea. If we're using any food as medicine, I do strongly encourage the organic variety of it. So green tea, again, if you find that even 25 milligrams is impacting your sleep quality, or some people do have sort of a hypersensitivity to green tea in the sense that green tea has a lot of stimulating properties other than the caffeine itself. So just be aware of that as well. But my recommendation is to find one that you find that you enjoy, that you feel is palatable. Also, don't overbrew the green tea, because sometimes that can make it taste very straw-like or very grassy. And there's beautiful blends out there. There's mint and green, and there's ginger green. There's I mentioned medicinal mushrooms. I'm drinking lately a reishi matcha green tea, which is a wonderful combination. So, it's a sort of, personal experiment in which types of teas you enjoy. But again, consider yourself kind of an apothecary when it comes to, identifying which of these healing herbs and plants you're going to be including in your tea repertoire. And your second question is about almond and cashew milk. So what's fascinating is that there are very few almonds and cashews in these products. And actually to call it a milk is, kind of also a bit misleading. The bottom line is that, certainly it's better than regular dairy. I mean, the only dairy that I generally have is the little dollop of milk that I put in my tea. I think, again, it was less meat, teat, wheat, and sweet. And to identify the suitable substitutes is also a very individualized process. One thing I would caution you about is the compound known as carrageenan. So carrageenan is kind of a thickening, emulsifying agent that is oftentimes introduced in anything like almond milk or cashew milk in order to make it creamier. It's sort of a texturizing agent. So be careful of carrageenan because actually it can increase the inflammation in the body. So just be careful of that and make sure that the brands of cashew or almond milk that you're using do not have that one ingredient. It's called carrageenan.
Thank you, Dr. Mehta.
You're welcome.
What is your opinion of sleep aids like melatonin or, if you only get 3 hours of good sleep and then you're awake for 3 or 4 hours and then you end up going back to sleep for another 2 hours? I don't have a whole good 6-7 hours sleep.
So that's a great question. So, what's really fascinating is that there's emerging evidence of this, what we call a biphasic sleep schedule. So think about it evolutionarily. When we were all living in tribal, societies, the matriarchs and the patriarchs of the tribe would actually have chores to do in the middle of the night. So, actually waking up in the middle of the night and being awake for a certain period of time is okay. It's part of our evolutionary baggage that persists. What I recommend is that if you find yourself unable to fall back asleep when you wake up, if you're struggling to fall back asleep for more than 15 minutes, get out of the bed and do something else. You can empty the dishwasher, I fold some clothes, something that doesn't take too much mental energy, something that doesn't give you so much exposure to this light energy, and then go back to sleep when you're tired. So every culture in the world over has understood besides ours, I suppose, has understood the wisdom of the siesta. So, and what's also interesting is the American Academy of Sleep Medicine has as its symbol the Chinese yin and yang. And nobody's really explained to me why that's the case, but what my interpretation is that during every period of daytime wakefulness, it's okay to have a little siesta, a little bit of quiet time, a little bit of a nap, if we have that luxury. And during every nighttime, it's okay to have a little period of wakefulness. So it's actually a misconception that we need this uninterrupted, 7.5 to 8 hour, a wonderful sleep duration and quality in order to achieve our best health. That's a misconception. So actually, it's our misconceptions about sleep that fuel our anxieties about sleep and then actually create this pattern of cyclical insomnia and, sometimes either sleep onset or sleep maintenance insomnia. The other part of your question was about melatonin. So melatonin is not actually a sleep aid. Melatonin is like a dose of darkness. So remember I said the symphony orchestra, every single organ system in the body is a different instrument section of the symphony orchestra, and melatonin is the conductor. Well, the environmental cue that our brains need to start producing melatonin is darkness. So melatonin is like a dose of darkness. And so think about it, melatonin generally we only prescribe for people who are jet lagged, people who have what we call a circadian rhythm disturbance. In other words, their night and day cycle doesn't match up with night and day. And people who have been night shift workers and who are now transitioning to day shift. So this is the way that melatonin is used. It's not necessarily a sleep aid. It's kind of a misconception that melatonin will help you fall asleep. The reason that we're rushing to the health food stores and picking up our melatonin is because we lack that evening darkness now. We get bombarded with so much light energy. These TV screens, the laptop screens, the computer screens, all these screens are bright enough to trick the brain into thinking that it's still daytime when it's actually night. So effectively, you're trying to conduct your symphony orchestra without a conductor being out there on stage. Right? So these simple good sleep hygiene techniques, by limiting that light energy that we're exposed to in the evening time, using things like melatonin or any other sleep aids that may be prescribed for you judiciously and transiently, so that you're not on them for a long period of time. And then engaging with other positive health behaviors, increasing movement as medicine, using exercise to improve the sleep quality. All of these things are really helpful when it comes to enhancing sleep.
Question here.
Hi, I heard your answer about almond and cashew milk. I was wondering, how do you feel about rice milk? And then I had a second question, which was my original question. It's about how do you feel about protein powders?
So your first question about rice milk, I mean, again, it's in that same category of suitable milk alternatives. I would keep a lookout for some of these ingredients that might be increasing inflammation, like carrageenan. But it's it's not so, we're not so strict when it comes to you must be using soy milk or you must be using rice or almond or cashew milk. It's a very individualized kind of approach, but certainly limiting dairy is the fundamental principle. And we also sometimes people can get away with one serving of yogurt a day as well, which is a dairy derivative, as we know, because we find that dairy has protein, has calcium and vitamin D, and has these probiotics that I mentioned also. So sometimes people can get away with using some yogurt in sparing quantities. Your other question was about a protein supplement, and we do actually encourage everyone whom we are counseling to take a protein supplement. And the reason for that is that when we start to use movement as medicine, especially engaging in some of these resistance training exercises, oftentimes using a protein supplement can reduce your recovery time. So that muscle soreness or that fatigue that you feel in between your exercise, the days that you're exercising, an extra 20 grams of a healthy protein can actually help you in your recovery time. So we do actually have two different types of proteins, very good quality products as part of our green pharmacy, and we encourage them quite liberally in our clientele.
Thank you. Yes. Then what do you think about soy products, like tofu and soy meat and all that stuff?
So it's really fascinating, the kind of research that's coming out on soy. Here in the United States, we're the world's #1 producer of soy and soybean. And we make so much of it that we export a lot of it. We put a lot of it into animal feed, and we still have mountains of it left over. So we process that soy into like a soy paste, like a glue. And then we reintroduce that soy glue into so many different types of convenience foods. It's like a texturizing agent, it's a filler. And that is it's in everything from granola bars to cornflakes and everything that's processed. So, that's the dangerous soy. So if you eat soy or soybean in its original form, we're talking tofu, edamame, soy milk, it's healthier for you. And soy also has these very important antioxidants. They're known as isoflavones. So these isoflavones, some of them include things like genistein and diazine. These are all soy isoflavones, which are really heart healthy foods. So if soy and what we're also finding is that those individuals who grew up eating soy actually have less of a sensitivity to it later on in life. So if it's been part of your nutritional sort of ethos, then we encourage and continue to recommend non-GMO organic soybean 2 to 3 servings per week as a very healthy source of plant-based protein. So that we're talking the edamame, the tofu, the soy milk. Really, the closer that whole organic soybeans are to the top of the ingredient list, the healthier it is for you.
Thank you, Dr. Mehta. Can you talk about herbal medicines like astragalus, ashwagandha, gotu kola, and the effect on mitigating inflammation and other aspects of MS?
So it's a very, very complex question. So you know, all of these are you know, astragalus, ashwagandha. These are immunomodulating herbs, and they're also what we call adaptogens. So there are these class of plants in the plant kingdom called adaptogens. In other words, they help us adapt, and certainly ashwagandha is one of those adaptogens. So you know, in those individuals who are sort of kind of in this cycle, this cluster of symptoms, and kind of entrenched in that cluster of symptoms. In other words, fatigue, poor sleep quality, maybe even depression, you know, chronic pain, any of these cluster of symptoms, sometimes a little bit, a judicious use of some herbal compounds is actually very useful. Let me give you some other examples. I mean, besides astragalus and ashwagandha, boswellia, rhodiola, all of these herbs can be used in order to reduce the inflammatory burden in the body and actually also have a slight mood-enhancing effect that has been borne out in some of the most recent scientific studies. So, you know, all of these herbs can be used in combination with some of the methods and practices that I talked about in order to help you heal. But you really do need to talk to somebody who knows about these compounds and how to prescribe them, you know, the highest quality of these products, number one. Number two, you also need somebody who's well versed in any herb-drug interactions, making sure that, you know, any medications that you're on are not counteracted or inhibited by the use of some of these herbs. So, you know, to be frank, the individuals with that degree of knowledge are few and far between. But when you find a good practitioner it doesn't have to be a physician, but you know, preferably they would be, because you know, herb-drug interactions are very complex and are an increasing problem out there. So you know, again, these herbs are very, very useful if used judiciously.
Question here?
A very quick question in short. You mentioned earlier milk thistle. What is that? I used to give that to my birds, prescribed from the veterinarian. What do you use that for, and what does it help or do? Please.
So milk thistle, the most common utilization of milk thistle is actually milk thistle seed. So there's a compound in the milk thistle seed known as silymarin. Now, silymarin has very significant hepatoprotective effects. So anybody with liver toxicity or is trying to detoxify, particularly the liver, can benefit from milk thistle seed, especially if it's a standardized extract that contains a certain component of silymarin in it.
You swallow it, or how do you?
Yes, it's used. It's orally ingested.
So you just get it at home?
That's right.
You have some amazing knowledge, and I think that what I'm getting from everything you're saying that I need to do is organic. Organic is the way. Is that correct?
You know, there's a really great thank you for that, by the way. I've been very fortunate in my life to have fantastic teachers and mentors. You know, I get this question a lot about organic foods, and preferentially the answer is yes. I mean, ideally everything we eat is organic, but that really can break the bank, you know, because organic foods are also quite expensive. So there's a really nice resource out there called the Environmental Working Group, EWG.org. Now, Environmental Working Group actually is a nonprofit organization that looks at everything from cosmetics, personal care products, foods, seafoods, and it's a very comprehensive website that can kind of, if you're really interested in understanding where these toxic burdens can actually come from, be they household cleaning products to, you know, personal care products and cosmetics, the EWG.org website is a really nice resource to look at, number one. Number two, they also have a handy list called the Dirty Dozen and the Clean 15. And what they've identified is those, if organic foods, if you find it difficult or cost prohibitive to use 100% organic, then what you can use is the Dirty Dozen and the Clean 15 in order to kind of use some conventionally grown fruits and vegetables, and then preferentially use organic when the need arises. So that's another handy tool that you can get from the EWG website, the Environmental Working Group.
Great. Everybody, let's thank Dr. Mehta.
Right, thank you.
Thank you very much. That was great. That was great. So I want to thank everybody that came here today. I want to thank everybody that's on our live stream. This is something new that we did on Facebook as a live stream. Next year, we're going to do a Facebook and maybe through our YouTube channel as well for those that do not have Facebook. And so our audience is just growing. And, we can't do these programs without you. I'm glad that you're all here. Please make sure you fill out those seminar evaluation forms. We need to know what you liked about the program, what you did not like about the program. I want to thank all the speakers we had today. I want to thank all our audience that we had today, live and in person. And, our sponsors, I got to thank them again. EMD Serono, Mallinckrodt, Genentech, and Celgene. So thank you, everybody, for coming here. Safe driving home. Enjoy the day. Thank you.